Welcome to the very first episode of our brand new podcast series, Doctor's Table, proudly presented by Phyathai Phaholyothin Hospital. Throughout this series, we'll be inviting doctors, surgeons, service providers to sit down and talk with us and discuss about diseases, treatments, and common challenges that patients face when seeking care. Our goal is to make healthcare easier to understand, more approachable, and to bridge the gap between patients and healthcare providers. So, today, I'm honored to be joined by two wonderful guests. May I ask each of you to introduce yourself, please?
สวัสดีครับมิงกะลาบา Hello, my name is Dr. Kritsakorn Srisom. I am orthopedics doctor, actually surgeon. I'm specialized in trauma, hip and knee arthroplasty, and other musculoskeletal disease. I mean, hip pain, knee pain, muscle pain, neck pain, anything that you have pain in your body. And I work here as a surgeon. I think it's around 15 years here right now. And I have a lot of surgeries was done here.
Hi everyone, my name is Pui. I'm from JPP Healthcare. I'm the director of JPP Healthcare Travel, and I'm very happy here to be today with you guys to share our experience and Myanmar people who comes to Bangkok to get medical treatments.
Let's begin today's discussion with some basics, okay? Quick, based on your experience working with patients, how do you understand knee pain and hip pain? And what have you noticed in your line of work?
From my experience working with patients, knee and hip pain are most among concerns, especially for older adults and those with active lifestyle. Patients sometimes can describe their pain like sharp pain while they are walking or when they are sitting and for long periods or even difficulty climbing stairs. And some mention a clicking sensation in their joints and swelling that limits the mobility. But they delay seeking help due to the fears of surgeries or belief that it's part of the aging.
From my experience, most of the hip and knee pain mostly come from joint ligaments and tendons, the structure around the knee, and mostly it's come from muscle aging, sometimes overuse, sometimes too much working, sometimes from injury or accident. And I can divide the patient into two or three groups. For example, the first group is the young patients, young athlete, the office worker that's come from overuse or neck syndrome or overuse, and the middle of age, around 50s to 60s, maybe come from trauma, fall, accidents. They play sport without any kind of injuries that bring the patient to me for the hip and knee pain. And for the elderly, absolutely come from the aging, come from the degenerative disease. I will let you know that most of the degenerative hip, degenerative knees, osteoarthritis, some patients they not feel pain until they got some injury or they stumble and fall, and they collect that injury. I think it's like accumulate. It's like you collect the money from 1 to 100, and finally they come to us to ask what's happened to me. I do nothing in the past, so I will say that it's accumulative. You collect many experience in your body, and the pains coming up a lot. The hip and knee pain and also spine pain may be the same problem. So we, as an orthopedist, we have to find out what actually happened to you.
When it comes to trauma, can you explain a little about the trauma injuries?
Okay, trauma caused from accident, right? But not only accident. We have one word for you: minor or micro trauma. So I will start with the micro trauma first. Micro trauma, that means some small injuries happen to you. The first one is accumulative, like I say. Office worker, they trauma from too much work, maybe 10 hours a day. And some sport injuries that have some minor trauma in the joint and collect every day, every single day. The second one is accident. The accident, car accident, road traffic, motorcycle, bicycle, sport injuries, soccer, football, tennis, everything's contact and non-contact sport. So what would you like me to discuss? Both of them or?
Yes, the first one seems interesting also because the
Okay.
first one is you were talking about the micro
Micro trauma.
yes.
Micro trauma. In terms of micro trauma, maybe it's useful in the when you exercise, when you work out, you have micro trauma in your muscle and that stimulates the muscle growth. That's the one of the meaning. But the second one is micro trauma that's from too much bad posture or too fast, too soon to play sport or hard working without any rest or sit too long or you have something the same every day like factory guys, factory people, they do everything. So they will have some strain and sprain in their joint, some strain and sprain in the neck, and also some strain in the hip and knee. Because, for example, sit too long. When you sit too long, your hip is so tight, your knee is flexed. Most of the ladies like to cross their legs in the work, and you know that when you bend the knee more than 90 degrees, the kneecap, the force that react to the kneecap is 6 times to your body weight.
Oh wow.
And you're bending a lot every day, you cross the legs, your hip like this, your muscle is imbalanced. And when you sit up, you feel that's the first sign we call clicking sound. But the clicking sound not always bad. Something happened because some of the muscle imbalance, and that muscle imbalance bring us into the poor alignment, poor posture, and that posture, if you collect it every day, it's become bad. That we call micro trauma. The patient mostly present to me with some chronic back pain, chronic hip pain, chronic knee pain. Both of three of them, I think it's the same story. Maybe we will discuss later. But for my specialized, the accident, the trauma, I'm graduate in fellowship of the trauma reconstruction.
Wow.
Actually, the full name is Orthopedic Skeletal Trauma, and hip and knee arthroplasty. So I learned about difficult and complex surgery. That's my job. When the patients come to me with the road traffic accident, any kind of road traffic accident, they have bad fractures, bad ligament injury, and bad joint fractures, and that is very severe case. That one will bring the patient to us, and I have to put the metal, actually titanium, on the affected joint, knee, hip, pelvis, maybe some spine. So the traffic accident are mostly the problem in Southeast Asia. I think in every country around Southeast Asia, Myanmar, Cambodia, and also Thailand and Vietnam, they have a lot of motorcycle accident, and the habits of the using the road is very bad. And also the rainy seasons, the drainage system is very bad, so a lot of injury happens here. The injury can be just a sprain of ligaments, stumble and fall a little, twist the knee a little bit. That may be ligaments if the patient can walk. But if the patient on the wheelchair, on the stretcher, so I have to be careful. If they have a bad injury, we will obviously see the patient what's going on. But some injuries, just a little, and the patient cannot tell us what's happened to the joint actually. So that's my job to explore the patient, what is and how many injury that happened to the patients.
Okay, sir. So basically, for big trauma cases, patient might have like several broken bones in several areas. So for those kind of cases, you have a trauma team, right? So you basically work with spine surgeons, hip knee surgeons, other trauma surgeons, right? You have a big team here.
Yes, as a trauma surgeon, I mean skeletal trauma surgeon, I am one part of the big trauma team here. For example, Phyathai Phaholyothin Hospital have a big trauma team, including general surgeon, vascular surgeon, neurosurgeon for the brain, vascular for the any vascular, and that's kind of surgeon have to work together. And if the right threatening injury is clear, and that's my job. And also me and my friends and my coworkers have a lot of teams. We have team A, team B, team C, and we stand by every day. If they have the big trauma surgeon, we will have trauma code like the movie, trauma code, right? Trauma code, yes, trauma code, and the orthopedic doctor will be in charge to taking care of any musculoskeletal disorder, any broken bone, any torn ligaments. For example, when I did surgery, at least doctors, have to do the surgery. Nowadays, we will not only one man show anymore. We will discuss the case, and we will plan what implant to use, how many hours. If the surgery time is so long, maybe I have to split for the patient safety. So we work as a team, not one man show.
Actually, I've experienced your work here as I'm working here in Phyathai Phaholyothin Hospital. During the earthquake, I saw the trauma team and ER team stand by and running around the whole time because we had a lot of patients coming from the Chatuchak building collapse area. So I've seen you in charge on that day also.
And thanks for many doctors who not in charge on that day. They 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 they, they come without calling.
So everybody came.
They came without calling. Yeah.
Emergency.
Emergency. It's like emergency decoration. It's like
Okay, how about Pupwe? How about you? Have you have experience dealing with the trauma patients from Burma?
Yes, I have. I have seen a lot of trauma cases, and when it's come to trauma, patients are really scared. They are worried about the emergency surgeries because they didn't expect that, and also the families is anxious because they are far away from home, and they are also worried about the paperwork and like visa and stuff. So we are there to support them and to make feel safe and support from our team. Yes.
So basically, when there are patients who had trauma and would like to come to Bangkok for emergency surgery, so you provide the services.
Yeah, we manage the emergency travel, and we were there from the very first step, and until to come here and admit to the hospital.
Now that we've talked about the problems, let's talk about the solutions. What are the available treatments for knee pain, hip pain, and trauma injuries? Can you give us a brief examples? Okay.
Thanks for Pew right, Honey, to manage the patients very carefully, and she have a good job because of most of the patient have fear a lot and their face.
Yeah.
You see, so the translator is very important, and thanks for the translate team and for you too. So for the treatment options, we have a lot. We have a lot of options of the treatment in trauma patients. So we will focus on only knee and hip only, right?
Sure.
Okay. If the trauma is not so much, that the sprain, just ligaments partially torn, and the medical team agree with do nothing, just non-surgical options. We have the physiotherapy team, a big physiotherapy team, a whole floor of a lot of instruments, a lot of ultrasound, shockwave, the laser, the PMS, like a magnetic. Every machine is their job is to stimulate the growth. For example, the minor ligament torn in the knee, no need to surgery. We have the, for example, Ultrasound is the tools like stimulate collagen and stimulate the healing without any injections.
Oh.
That's the first step for me. And if the nerve damage, for example, the nerve around the knee have been crushed by something, and the patient have pain along the nerve, we call neuralgia. The patient will feel so bad. If they cannot solve by the medications, we have the machine called magnetic treatment. Magnetic treatment. That magnetic treatment can calm down the nerve. Can calm down the nerve. We just put it around the nerve. The nerve will be slowly heal themselves. Absolutely, it takes a lot of time. That's the physiotherapy part. For my job, I have the tools, right? Like a brace. You know brace? It's like some knee stuff or some adjustable angle to put on the patient's knee. Another thing is the splint, slaps or cast to treat the non-surgical case. And for the surgical case, if the team agree with we have to do the operations on the patients, we will have a little meetings and discuss. For example, if the knee broken into 4 parts, the hip broken into 3 parts, what should I do first, knee or hip? And what the implants to put on the patient's knee, any kind of ligaments, suture, any kind of a metal or titanium to support and construct the patient needs like the same. We have many options, and every options we have to carefully select to each patient. I will say that no one solution fits all. We cannot do the we call stamp operation. You know the stamp operations, like do the same operation in every patient, and
okay.
patient will back to life. That's not my concept. That's not my concept. We have to customize every patient because every patient have different fracture, different jobs, different lifestyle. Okay, for non-trauma,
Non-trauma, yes.
such as osteoarthritis of the knee, osteoarthritis of the hip. First, we have to send the patient to physiotherapy. This is very important, but many patients and many cities in Southeast Asia not focus on physiotherapy. The physiotherapy is not just massage. It's about to change the patient's habits. So it takes time. It's not just the tool that and heal. No, not like this. The very important is exercise to build the muscle. For the knee pain from osteoarthritis, the muscle will weak and atrophy, and the joint will respond for the patient body weight. And that's the loop. That's the we call vicious cycle or the bad loop. The muscle is not strong. The knee joint is damaged, and the patient rests, and then come to atrophy again. The muscle not so strong again, and it's the loop. So the physiotherapy will interrupt that bad mechanism. First, to let the patient exercise safely. For example, aqua therapy or the muscle stimulation or light exercise. If everything, I mean, if the therapeutic exercises not working for the patients, that is my style. For me, I have the medications, joint food, joint supplements. Joint supplements like orally. I mean, by eat have the medication by mouth. For example, glucosamine or collagen that support the hip and knee. If the medication not work, also the painkillers. For me, I don't like the patient to have a painkiller so much because if the patient take it so much, it will damage the kidney and liver. I talk about the injections. I mean, injection into the joint. We have we call filler. Filler. The real name is hyaluronic acid.
Okay.
We have many concentration. We have many brands. Mostly is from Switzerland. Mostly is from Ireland. That's a good quality to lubricate the joint. And when the joint is more lubricated, the joint will move better.
Actually, the hyaluronic acid injection is very famous among our patients. Yes, because they don't want to do the big surgeries yet. So they come back almost like I've seen patients coming back maybe like 3 to 6 months, every 3 to 6 months to get the injections. And another thing that I know about is the PRP injection. So what's the difference between the PRP and the hyaluronic acid?
Okay, the PRP and the hyaluronic we call is non-surgical treatment for the patients. I will say that the hyaluronic acid is the first line of treatment. That every orthopedic doctor and everyone accept. But the PRP we call the alternative line or second line treatment. For the PRP, you know the full name, platelet rich plasma. So we have platelet-rich plasma and we have platelet-poor plasma. PRP not stem cell. But for PRP, many countries except that UK, US, and also Thailand Medical Council, they accept to treatment in Thailand. But you have to be careful. You have to ask the how they made the PRP for you. sterile or not, safe, good quality. Okay, that's the one thing. But for the PRP, the difference is the PRP is for stimulate the
Healing process. Okay.
but the hyaluronic acid is for lubricating the joint or cover or fill the joint that dry and damaged from the bad cartilage or osteoarthritis. Both of them can bring the patients good quality. But for me, I will choose the hyaluronic first because it's the first line and it's very acceptable in many patients and country. If the hyaluronic one or two times does not work for the patient and the patient knows what is the PRP and patient believe me, I will try PRP for the patients at least 2 times and every month for 3 times. At least 2 times. Maximum is 5 times. 3 to 5 times. The patient will see the results. Not every patient, because every patient come to me in many stages, right? Some patient come to me with only stage 1, stage 2. That's very a little degeneration. That one, I mean, the grade 1 and grade 2 will be, the PRP will be work for them. But for grade 3 and grade 4, PRP may be helpful if they don't want to surgery. But for me, if the grade 3 or grade 4 advanced grade, I will recommend surgery at the first time. But if the patient still have to make a decision or ask the family, I will give them hyaluronic acid. Maybe a little bit of steroid, medically steroid, not the bad steroid. And that's the difference of the PRP and the hyaluronic acid treatment.
So, doctor, that was very informative. But I would like to know, um, as a patient, sometimes they do not want to do the big surgeries, right? Like I mentioned you before. So, as I understand from your information just now, there are 4 stages. So, the first stage is maybe you will do physical therapy first, right? So, can you explain? I would like to know the 4 stages and what are the options.
Okay, hip and knee arthritis. So we will talk about arthritis only. Osteoarthritis uh, is a disease that come from wear and tear
Wear and tear.
of the knee or of the hip. We can divide it into 4 stage. 4 stage. For make it easy, I will divide it into the the simple stage and advanced stage. The simple stage is 1 or 2. Actually, we cannot separate what is 1 or 2 actually. But for advanced stage, we can because the patient knee is deformed, not knocking, or how can I call virus knee, เขาโกง how can you call เขาโกง
It's like
bow knee,
curved out.
bow leg, bow leg,
Okay.
เขาโกง in Myanmar how can you call
Quit. Shut up. Quit. Yes. It's like curved outside, right?
Yeah,
It's
yeah.
to the outside. Or
So that's the sign of advanced stage. Okay. For the treatment in the first or second stage that we cannot observe the patients, we have to do MRI in some case to difference what is the stage. For the first and the second stage, we will send the patient to physiotherapy and learn how to exercise the knee properly. And then we will recommend them to have medications like glucosamine, Atroda. Atroda is not the NSAID, it's not a painkiller, it's like the medication that reduce some inflammatory and it's work, but it's quite expensive. And the painkillers that they can take is for some times. And for the injections, we will recommend PRP and hyaluronic acid because that's the simple stage. We can do everything. But if the patient actually come with the sudden pain and they cannot walk, but the X-ray is just the first stage. Just a simple thing. Maybe I offer them a little bit of steroid to reduce some inflammation before I give them filler or hyaluronic acid. And for the advanced stage, mostly I recommend the patient to think about the surgery in the future. Not hurry. Talk with your family. Discuss with yourself how long that you have to live. The health span, not the lifespan. You know the difference. If they want a good health span, the surgery may be an option, right? But during the decision making, I recommend the hyaluronic acid to lubricate their joint first. It's like put the joint nutrient directly because when the patient come to advanced state, I don't like the patient to have a lot of medication because some patient have a full bag of medication, hypertension, dyslipidemia, diabetes, many things. So I recommend inject the hyaluronic first to fill the dry and damaged joints first, maybe around 3 times. If they choose less concentration, this is quite deep. We have 1% hyaluronic acid. We have 2% hyaluronic. We have like a long acting hyaluronic, long lasting hyaluronic, and that's come with the cost. But for me, I like to step by step. I will not give them the expensive one first. We have to try the cheap one, the good quality. Every filler have the good quality, and if the hyaluronic don't work, PRP as an option may be recommended, but the patient is different, right? We have to discuss first. If they fail the hyaluronic acid, they fail the physiotherapy, and they fail the steroid. Maybe the PRP may be helpful in some case because the PRP not only stimulate the growth of the damaged cartilage, they stimulate the tendon growth too. Osteoarthritis, hip and knee, not only damage the joint, the arthritis damage the ligaments, the tendon, and the muscle inside, and also the bone. The bone quality is the big thing we have to discuss later, not this podcast, right? Because that's very the big topic here now. Okay. I mean osteoporosis. And finally, if everything's fail in advanced state, so we recommend surgery, knee replacement or hip replacement.
I think that's a very good information that we have because most of the patients, they try to avoid surgery, of course, and mostly for cost or like maybe like you said, like for health reasons also. But it's good to know because as we discussed here, I found out that the important thing is preparation, lifestyle adjustment, like you said, to avoid future surgeries or future injuries. So if you're in the stage 1 to 2, if I may conclude, if stage 1 or 2 patient comes in with a knee pain, the doctor will suggest physical therapy, medication, and if that's not work, maybe hyaluronic acid or PRP injection. And during the physical therapy, as you said, maybe the patient has to do a long-term physical therapy to have their muscles grow and support their knees, right? And maybe they have to adjust lifestyle as well. Maybe lose a little bit of weight, do more exercise to strengthen the knees, muscles, right? Is that correct, sir?
That's correct. But most of the patient will ask me, do I have to do the physiotherapy at hospital every day? Yes. The answer is not because the physiotherapy is not the physiotherapy things at all. It's about the patient's commitment.
Okay.
They can do physiotherapy at home. They can manage their food intake. I mean calorie intakes. I I will define the physiotherapy in maybe a very like a big idea. They include the weight loss program because weight loss program have to exercise, right? And when you need to exercise correctly, you have to consult someone.
Sure.
Physiotherapist is someone. Other than nutritionist, I think the patient will not consult the nutritionist so much, and no need to do physiotherapy at hospital. They can do themselves at home if they can do it correctly. Everything you said is very correct.
So what I'm understanding from what you're saying is, we have to make sure that you find the proper investigation first to know what stage you are on.
Yes.
Some people they think that when they have the knee pain, they think that they have to go straight to the surgeries, and that's not the case. We have
No,
to
no, no, no,
we
no.
have to explain that there's a now I understand that there's a full stage before to get to the surgeries.
Okay, I will say that 80% of the knee and hip pain patient, no surgery, no need to surgery. Only 10 to 20% of the hip and knee pain have to surgery. So don't be scared to meet us or meet her.
So it's the message to the patient that to make sure to get the early investigation first, right?
Let's say for the last stages, stage 4, there, like you said, 10% or 20% has to go through surgery. So what kind of surgeries are available for hip pain, knee pain? Let's start with knee pain. So what are the options do we have? What kind of surgery? What is total knee replacement?
Okay.
Cheers.
Can I show the implants?
Sure.
Sure.
Okay. So please don't scare of the implants. This is just the example. Okay.
Okay.
So nowadays, the knee replacements and hip replacement are very common in in the world. I can say because we learned from the past, maybe around 100 years ago, orthopedics doctors start from that. You know what? We start from the dental implant first. Actually, it's the same metal from dental implants, and we still that knowledge. I mean, the orthopedist, our professor in the past, our mentor in the past, still the concept of the dental implant. So nowadays, the knee replacement is very common. We have manual one, we have computer assisted, and we also have robotic assisted. Not robot make the surgery, is robotic assisted. I mean, the robot, the AI will calculate the the hiding factor that some surgeon cannot take it. I will say it's more accurate.
So it helps with the accuracy, more
Help
accurate.
more accuracy, but not every doctor like to do that because it takes times and have a cost and have it encountered and cost. And now the robotic surgery is not the mainstay. Also, the computer assisted is not the mainstay because many barriers. So I will say the manual one first. Around, I can say 90% in Thailand, we do the knee replacement surgery manually, but with the very precise instruments, and we have the tool to like to prove that's correct or not. We have many tools to verify before we get the patient out of the operating room. Let's start with the knee replacement first. So I will show you the real implants. This is the knee prosthesis. The knee prosthesis. This is include of the femur or thigh bone, and this is the implant for the shin bone. Yeah, and this is the middle of two metal. We call the insert or the plastic. This will be replace the meniscus or cartilage. Uh-huh. You see, the implant is not so big, and the design of the implant is not. I think most of the patient will understand that knee replacement is cut the block of the bone off,
Exactly.
and then change the new one. No. We not do that. We just slice
Oh, I
the
see.
damaged cartilage,
Oh.
and this thickness is the slice mesh depth of the thigh bone.
About one
Around this,
centimeter.
around
Yeah.
less than 1 centimeter.
Ah, okay.
We slice into the block, not cut the whole knee out, and I change the new one. That's the patient job. So I have to make this one clear first.
Okay.
and this is for the tibia bone. You see,
Yeah.
it's like something put inside here.
Oh.
So we just slice something. It's like slide the ham,
Uh-huh.
slide the cheese with very sharp tool. Some patient will ask me after operation that what is the construction around the operating room, because we have the power to light the carpenter. Some patient that don't want to sleep during the surgery, but mostly I like the patient to sleep because I don't want they to hear my power to
They don't hear
noises.
the sound.
it's yeah. It's like we have the hammer inside open room. So we slice the bone, the bad cartilage, and we put this one. Before we put the metal inside, we have the cement. We have the cement insert into bone first, and that cement and the implant will bond
So
very strong.
it's like you put a glue inside first, correct?
It's the glue.
Cement is a glue. Okay.
Cement is the glue, but the glue is clear, right? It's clear liquid, right?
Clear.
But the cement is something like this,
Oh.
and it's very strong. We cannot pull it off from the patient easily. We have to saw. We have to cut it.
Oh wow.
Okay. And after we put the cement, put the implant, we put the hammer on a little bit, not so hard.
Okay.
And then we put the plastic. This plastic is very special. It's like the bush in the car.
Pushing. Okay.
Bushing in the car. Bushing in the car. It's absorb the shocks. And this is made from compression of the polyethylene. And then they put the gamma X-ray to compress the molecule of the plastic. This is 30 years implants
30 years.
Oh wow.
from the real patients. The patient falls and they have some bad injury in the knee, so we have to take it out. You see, everything is still like the same.
Yeah.
30 year. This is the 30-year technology. So what about now?
Oh wow. Okay.
Maybe this era maybe 50 years before it's damaged, and then the fully construction is like this, and you see it's really very smooth.
Oh wow. Okay.
So after operations, we will encourage the patient to move early to use the joint, and they will feel better immediately after operation. It's not immediately. 6 hours after operation, we will let the patient walk or stand on the bedside first to feel the new implant. And then we will gently and gradually increase their range of motion. A little bit pain because of we have the good anesthesiology team to numb the leg without weakness.
Okay.
That's the important one.
Yeah.
Most of the patients feel that when they come to surgery, they will stay on the bed like a zombie and they cannot move. No. That's not correct. After 6 hours of operations, if everything is stable, we will let the patient get up and stand and do some marching on the bedside. And tomorrow, after 1 day after surgery, the patient will walk with assisting device. I mean, gate aid or the cane. That's for the knee. Any questions?
No.
Have you ever seen this?
Never.
It is made from titanium, chromium, and metal, and that's not toxic to the patient's immunity. So the patient can every patient. I never seen the patient not accept this one because this is very low immunity.
Okay.
So the white blood cell or the patient bone will get this one into the knee very fast, around 3 months.
What's the lifespan of one of these implants, sir?
Okay, the implant will last forever.
Forever. Okay.
I can say will last forever
Okay.
because some of my patients they die, right, and their son or her son or his son, they come to tell me that after the body burn, this one's still intact.
Oh.
But this is the most common question that the patient asks me in terms of the surgeon. How many years that the implant will stay in the body? I will say last forever. But the thing that go first is the bone quality.
Okay.
So if you're not taking care of this one, I mean, taking care of the bone that's have the metal on the bone, very good. The bone will weak and the implant will be sink down. Maybe in 30 years or 20 years. That's the concept of, that's why we have the patient to change the lifestyle before or after operations to let the bone strong enough to support the big implant like this. Is the knee replacement is not just change and go home, and then we not make an appointment. I will make an appointment until the patient bore me because I like to see how they change the life for the Myanmar patients, for the Burmese patients. I'd like to have some video call without coming here, without coming to us in Thailand. If they like, they can come here to see me and what's going on in the knee, maybe after 3 months or 6 months after operations. But after that, I like to see how health span or how they walk and how their lifestyle changes.
So what's the material is made from?
Okay, you see the shiny and polished material is the chromium,
Chromium.
and the gray one is the cobalt, titanium, and some metal. And this one is the we call polyethylene. It's the plastic that used in the bushing or support the car or the big truck joint. It's very strong. And this one is also the cobalt, chrome, and titanium too.
So where are they from?
Mostly the implants in that used in Thailand is from Germany,
Germany.
Okay.
it's United States, or Switzerland.
Oh.
How about you, sir? Which product do you like to use?
Okay,
If patient are to come and have the surgery here in Phyathai Phaholyothin.
Okay, in this hospital, we have many brands. For example, Dupuy and Johnson, Johnson and Johnson, and Smith and Nephew. You can search in the internet for the company or Stryker. These three brands most commonly used in this hospital. The other brand, for example, the Simmer, the Biomed, or else. That's it. Everything is imported. We cannot make it by themselves. Actually, we have the implant from other country, but we will not use it for sure.
Thank you. Thank you for the
For the
explanation,
knee,
sir.
okay.
I've actually seen different kind of prosthesis, early implants. For different cases, there are sometimes you would suggest, surgeons would suggest different kind of implants. For example, people that has a high allergic to metals.
Okay, that's a deep question. So this is the regular one. Some company provide the coating that specialize in the metal allergy patients. For example, Smith and Nephew brands that I or my team commonly use, we have oxynium coat. It's like ceramic coating that can cover the cobalt chrome and the metal. So the smoothness will be better. The longevity of the implant will be better. And absolutely, and they come with a cost. But for me, if you don't have the problem with the financial, I recommend the special coating. Oxynium is like a OXINIUM. It's made from, it's like hypoallergic material, and that coating is very popular in the United States, but it's come with the cost for sure.
Higher cost. So that's why.
So we have choice for the metal allergy patient. That's what I have to say.
So that's why different patients have different costs, even if for the same surgery, right?
Yes.
It depends on the implant that is used.
Yes, we have to discuss this after the patient decides the surgery.
Okay.
Option of the implants.
How about for the hip replacement?
Okay, the hip is most likely the same. So we have this one we call stem. We call stem. Okay, this is the most recent stem design amongst 10 years. We call taper and plasma coating. And this one we will insert in the patient without cement. Without cement. That's why, because we have special coating here. And many research during 10 years prove that with this coating, we call plasma coating, is like you put the metal in the spray and this one most likely the bone construction. And when this one go inside the patient bone, the bone will this is the friends. They will creeping and bonding very tight.
They
So
bond
as-
together with this material.
Yeah, but that not mean you have to use the cane or use the walking aid, because we will put it very stable in your hip, in the femur, in the thigh bone, and we will test that strong enough to weigh, and then we will put the head that is polished and shiny, and you can see this is made from chromium and metal to the head, and then this is finished for the stem, I mean the femur bone. And then for the acetabulum, I mean the pelvic joint, how can you call the
Socket.
the socket? Yeah.
Yes.
And this is the implant for the socket. Also cementless, we call no cement because the coating, you see,
Yeah.
and we have the hole. You see the hole.
Okay.
The hole is used for inserting the screw for more stable. And because of the coating, we can use only this one, not the cement, to support and make it more stable. And when this come to the socket, we have the plastic again, the same material for the knee.
Yeah,
The color will be a difference because this is the difference company. This is from the Pui. This is from Smith and Nephew. This plastic, they infuse the vitamin E. That's very surprised, right? For treatment of the plastic to better longevity. Okay, this is the same material of the knee. You see, but the color is different because of the Smith company infuse the vitamin E to their material. They claim that they can increase more longevity of the implant. So we attach this and put the hammer on sockets, and then we reduce. Oh, you see, it's very slippery.
Yeah.
You see. You see, your new hip will be very, very smooth and very, very how can I go lubricate without any joint lubricate anymore.
Yeah.
This is for the hip replacement. And the same, the patient can walk 6 hours after operations if the patient is stable and good enough.
Okay, Pupui, can you walk us through the entire journey that international patient experience, starting from their very first inquiry with JPP until they do the surgery here?
I like to share with one of my patient cases, and every patient they start with a message or a call. So I want to tell you about this case. One of my friends called me, and she told me that there's a girl. About the girl, she's like only 25 years old. She had a terrible accident, and after the accident, she cannot walk. He cannot stand, even sit. So her family's worried too. Her family is they lost hope, and they're trying to, they don't know where to go, where to contact, and they don't know where to choose, the hospital or the doctor. So there we came in. We start with the consultation first, and we give them full informations, and they choose the one of the best hospital of orthopedics hospital, and they choose the Dr. Kritsakorn Tim. So we are there from the very first step. We have to, because she cannot sit properly, we have to arrange the ambulance from her hometown, and she live far away from our city, from Yangon. So we arranged the ambulance, and when her plane landed, and there's the hospital arranged another ambulance to admit to the hospital, and we support with the document. We support with everything they need, and we also support her family where to stay during the stay in the Bangkok, and yeah, we pretty much even I came along with her, because I want to feel safe and supported, because that would be her first time flying to Bangkok, and of course their concern is, they are very scared what the doctor might say, and of course they are worried about the cost too, because and that's one of the most common concern among our patients, because they worry about the cost. But once they get to the hospital, they feel welcome by the hospital staff, and we explain what he's gonna do for the surgeries and stuff. So after the recovery, and after the recovery, she's worried too, and because she cannot even walk properly, and during the surgery, it takes about like 8 hours. Heart surgeries take about 8 hours, and the next day, with the help of the doctors, she can even stand up. Before that, she cannot even stand. She have to take the emergency plane, and after the recovery, and she's worried that what might happen when when he got to the hometown, and what might I mean. So we were there for her, and we will give them we will give her the full informations from the hospital that she needed. And when she go back to her hometown, she was sitting on the chairs already. And then and the next treatment after her follow up, she was walking and coming to the hospital. And that was a very, a very, very overwhelming, like very happy for me to assist that kind of patients for me. Yeah.
So you were able to help a patient that had, I would say, a trauma case, right?
Yeah, that was a
So a
trauma
trauma case because
case.
she was not able to walk, let alone sit, right?
Yeah,
So she was bedridden, and then you, with the help of JPP and the doctors, you were
Yeah.
able to bring the patient here to Bangkok to
Yeah.
have the surgery here. So you basically supported with the documentations, with the air ambulance. Wow, thank you very much. I think I remember this case. It was Dr. Kritsakorn's case, right?
Yeah,
So maybe, doctor, maybe you can talk about this case a little bit for us.
Okay, the young ladies,
yeah.
the first time I saw her, she looks depressed already. She stay on the bed only. She cannot move her body on the side because of the pain in the hip, the hip joint, and also the pelvis because of she suffered from the bad accident. I think around 3 months before come to see us.
Oh, wow.
Yeah. She was afraid that she think that she have to stay still because of the broken bone. So she waited 3 months to get here.
And due to the patient is very young, she can tolerate the long procedure hour in the operating room. And after operation, maybe around 1 or 2 days, she can sit.
Yeah.
She can sit by a little assist by physiotherapy, and that's very happy in every patient. And I'm very surprised that she's she stay on the bed for around 6 months before see me, and just 2 days after operation she can sit without uh, any worry. I think she has very like very willing to live the life. It's like she very she a fighter, absolutely fighter. So the for the procedure is quite complex and difficult to explain for you all, but it's successful operations and everything is stable enough to let patients stand. I have to say that. And then after 6 months, maybe when she walked into my room, I cannot remember her because everything is look different. She very cute girls coming here and she sit down and who is she? I cannot remember. But I remember her from the x-ray. So sometimes the patients it's changed, right?
Yeah.
If they got the proper treatment, they got proper
Yeah.
care by you and by your team, they change. That the lifestyle change by her own habits because they're willing to live. Nothing to do about physiotherapy so much because she can therapy themselves. She can do her own therapies by walking, by traveling, by taking care of her parents. That's the physiotherapy for me.
For patients who has not walked or even sit for 3 months, it was stuck in bed for 3 months, like you said, she was depressed. The willingness and the eagerness to fight for their health is very important also. So not just the surgery, even if the surgery was successful, the rest also depends on the patient. They have to have this fighting, right? They have to fight for their recovery also. Okay, thank you very much, sir. So I think today was a very productive day for us. We've talked a lot about the treatments, options, many treatment, like you said, implants. We even saw the implants, right? So thank you very much, doctor.
Thank you so much for today. It was very productive. So before we close this session, is there anything that you would like to say to the patient seeking help?
So I have to say that I am a surgeon, but I am not a butcher. I have to say that, and I treat every patient and I taking care of every case by principle. We have the guidelines. We have to customize in every patient. So I will not put every one of you into the surgical table. Please, not afraid. So if possible, if you have anything, you can contact him or her, Kun Harold and Kun Honey, and then you can make an appointment to see me first, and I will explore what is your problems. But if you cannot, we have the internet. We have the telemedicine. I can give you some times for discuss what is your need, because some patients don't know what their need is. They have a many confused after they talk with many doctors. Some doctor will go straight to surgery, right? It may be sometimes me. Some patients they receive the information that no need to surgery, but that case have to surgery. So we will find a solution for you. So the same, just come and discuss. We call discuss. The patient health problems is very different. So let's talk.
Okay. Thank
That's
you,
it.
sir.
Thank you.
How about you, honey? Is there anything that you would like to say to the people watching and for the patients from Burma?
So over 10 years of experience supporting international patients, and my message is do not delay your treatments out of fears or confusions. We understand that traveling for medical can be very stressful, but we are here to guide you and support you every step of the way. And getting help early can improve your quality of life, and we will make the process as smooth as possible. So thank you very much.
Thank you. That's very good to know. So let me conclude today's session. If you're facing any hip pain, knee pain, or even for trauma cases, do not be afraid to seek out for help. We are here for you. The doctors are here for you. There are people like Honey that's helping patients from Burma to fly over here to have the treatment here. Don't be afraid to talk to us. Contact the doctors. Not every case has to do the surgery, like the doctor said.
True.
Yeah.
Sure.
So talk to us, explore the options that you have, and go from there. So like Pepe said also, do not delay your surgery or do not delay your treatment out of fear. Thank you very much, Dr. Pepe, for today.
Thank you for having us.